My name's Peter Slavin, and I'm the president of Mass General Hospital, but more importantly, a graduate of the MGH Medical Residency Program. I want to thank you for looking at the program and hope you'll seriously consider it as you make your choices in the coming weeks or months. My life was really changed dramatically by my experience as an MGH medical resident, and prior to that as a medical student rotating through the service. It was really during that experience that I fell in love with internal medicine and also fell in love with this hospital.
The Bigelow service is really the flagship of our training program here at the MGH. It is really this remarkable experience that the house staff have. And it's designed not only to deliver outstanding patient care, the best education we can, but really to train the house staff in leadership, in teamwork, and things that they'll carry forward with them for the rest of their career.
I think one really cool thing about the Bigelow service is that it actually reflects how we're supposed to be taking care of patients now, with how everything is transitioning towards comprehensive care and team-based care of patients, involving patients at the bedside in their care, and that's what Bigelow rounds are now. A team of doctors thinking together, walking around together, spending time at the bedside with patients, explaining to them what's going on that day, and actually formulating that plan right there at the bedside. That's what medicine is supposed to be like today, and that's what it's always been like here at MGH.
I think the Bigelow is this vibrant, living, breathing thing where you're making decisions together as a team and learning a lot from each other, but also appreciating how much other people bring to patient care and teaching.
A typical Bigelow team is comprised of approximately a dozen individuals, all of whom work in close coordination to take care of a floor of over 20 patients. There are 5 of these teams, known as Bigelow A, B, C, D, and E, each one regionalized to a single floor of the hospital. Most Bigelow teams are supervised by 2 attendings, also called the Bigelow visits. These attendings are often a complementary pair of generalists and subspecialists who together can provide both breadth and depth to clinical care and teaching on the Bigelows.
My favorite thing about attending on the Bigelow, which I've been doing now for 2 years, is that everybody really gets very involved in patient care. And despite the fact that you're taking care of patients as a team, everybody feels a real sense of ownership and engagement in every single patient that they're taking care of. And so I get to benefit from that because I get to learn from every single member of the team that I'm working with, and thinking about this one patient and talking with 4 or 5 other doctors who are helping take care of them on the resident team.
While attendings are present to provide supervision, our team leaders are truly our junior residents, who are often referred to as JARs, and work either individually or in pairs.
It is the one job that has really made me have to step up more than anything else. There's an incredible amount of responsibility. You're suddenly having to take on all of these different roles, to not only leading from a medical perspective, but also dealing with the case management teams, having to teach, being the support network for families. It's just the most extraordinary opportunity. And every day is so hard, but I just feel myself growing so much. It is by far the best job of residency thus far.
For the junior resident, it's really the first time that they're actually taking on a leadership role in managing a team, taking care of the interns, the medical students, and most importantly, the patients on the service. Our program is a lot about developing leaders of American medicine, and I think it starts with the Bigelow Medical Service.
From admission through discharge, JARs lead teams through rounds and delegate and provide oversight for daily clinical tasks. Next is the real backbone of our clinical services, a team of usually 4 to 5 interns. To better explain what it is a Bigelow team looks like, we constructed a mock team and followed them around during a morning of rounds.
This is Jake Johnson. He's 28 years old. He actually came in for cough, fever, and...
So this is our 72-year-old lady with a history of hypertension, CAD, and CHF who presented 2 days ago.
All right, guys. So, endocarditis.
On any given day, interns will be assigned to one of 4 roles, which include plans, day call, swing 1, and swing 2.
Our plan for this patient today is we're going to continue diuresing her. We're going to give her 40 of Lasix IV this morning. And the role of the plan intern is to run plan on the 20 patients on your Bigelow service. And what that means is that thinking about what needs to be done on each of those patients as far as advancing their care for that day, coming up with that plan, expressing it on rounds, and then seeing to it that all the necessary tasks get done. And really, one of the most amazing parts about being an intern on the Bigelow is that every day is just filled with so much on-the-job learning, and particularly when you're in the plan running position, you might be running plan on a patient and you may not have all the answers, you may not know all the detailed points of management for that patient that are important to run the plan that day, and that's when the really great educational opportunities happen. That's when your junior, your co-interns, your attending, they will share knowledge with you in the moment, and they will also suggest ways for us as a team and you as an individual to learn about that topic, and then the next time you encounter that problem on that patient or your next patient on the Bigelow, you feel much more confident and you really feel like you've learned something concrete.
So we break up CHF into a physiologic system so we can target each one of them individually. So for the first way that we normally do this is that we'll talk about what's the person's preload in their building. Being a junior on Bigelow E during the first month of the year was probably one of the most rewarding experiences I've had. You get to see 5 people who came from 5 very different medical schools transform from students into doctors in front of your face.
So Neil and I are the swing interns on the team. Swing is a term you'll hear a lot here at MGH. Basically, it just means that we sort of accomplish all the non-admitting tasks that have to be done on the existing patients on the floor. So that can be anything from calling consults, ordering labs, following up on labs, calling PCPs. Basically, it allows sort of the admitting intern to sort of focus only on admitting and allow the team to just focus on rounds.
The day call job as an intern is when you come in at noon and you are the person who admits all new patients to the floor for your team. And this is a great job because you get to come in at noon, you get to focus entirely on admissions and learning about new patients while the team takes care of the rest of the patients on the floor.
There will also be one intern who breaks from the role rotation to do a string of 4 to 5 nights. This allows a fully integrated team member to admit new patients to the service overnight while also continuing to address care of existing
It's getting
patients.
worse. His cough is producing a whitish sputum and he's never had these symptoms before like this. So I tried to focus on a pretty good physical exam.
So the things I like about the night float are that it gives you an incredible sense of responsibility over a lot of patients. And this can seem a little intimidating at first, but you really feel such a sense of accomplishment and learning when you are covering an entire group of patients by yourself and admitting. Also, there's always a senior resident called Night Teach who's available whenever you have an issue or want to discuss a problem. So really you always have support, but you feel autonomous, and really that's where the learning happens.
My job as the Night Teach is to support that intern as much as she needs, whether that's in the form of developing teaching points, figuring out the plan of care for those patients, supervising procedures, or taking care of old patients who are getting sick as well. At the beginning of the year, the Night Teach is really involved very heavily with the intern on all sorts of decision making, whether it's putting in orders, deciding doses of antibiotics, talking to patient families, whatever the intern needs. What's exciting about the Bigelow is the intern really develops quickly and becomes comfortable in their roles, whether it is daytime or nighttime. And by the middle and the end of the year, we really step back as Night Teachers, focus a lot more on teaching, looking at the evidence behind our decision makings, and letting the intern really fly on her own overnight.
The final group of care providers on our team are the medical students. Our medical students are primarily Harvard medical students in third-year clinical rotations. During some months, we will also have sub-interns, who as a pair will replace one intern on a Bigelow team and split daily roles and responsibilities as any other intern would on the service.
I'm Aditi. I'm one of the interns. Bigelow system is awesome. Things I like. Working with a team of co-interns, so you never feel lonely. You're always taking care of people, taking care of patients with a fun group of co-interns. The juniors, by and large, have been pretty good.
I think that's the magic of the Bigelow, is that people realize they have tremendous colleagues.
It's just a lot of fun. it's just a lot of fun. It's a lot of fun to think about patients, a lot of fun to come to work every day. And being in that kind of an environment where we're all thinking about a group of patients together is just incredibly engaging. It makes you want to get up out of bed every day.
It has been the model of the Mass General training programs, and not just the medicine one, that we're here in a collective together to learn as a team. And I think that one of the things that separate us from the rest of the country is that ongoing belief that we can learn better as teams than as individuals, and that much of what we actually gain from each other comes through collaborating in patient care and learning from each other.
Sometimes as we synthesize data and integrate data, it's easy to get hung up on the small details, but the Bigelow really forces you to sort of pick out those pieces, synthesize them together, and figure out what is the big picture for this patient.
Well, that the Bigelow takes care of some of our most interesting patients. The house staff and the attendings together have the opportunity to see an extraordinary range of disease, an extraordinary range of presentations within a given disease.
I love attending on the Bigelow Medical Service. It's one of the highlights of my career. Working alongside some of the most talented interns, junior residents, and senior night teach residents is a special joy for me. The dedication that our house staff has towards our patients is something that continues to motivate me as the program director.
In many ways, our program is set up to teach you how to be an attending. Every experience from intern year through senior year is designed to push you a little bit further towards that goal. Each rotation is not simply set up to help you master being a junior resident or a senior resident or an intern, but rather to take that next step towards being an attending and being an independent practice.
I love the Bigelow system because you get to learn about a huge number of patients over any given 2-week period. I think last time I counted, it was something like more than 80 patients in a 2-week period. Lots of physical exams, lots of learning. You get to really work as a team and get to know your co-interns, which is fantastic.
That experience and having seen, 500 chest pain cases so that you know when to triage the end-STEMI from the pericarditis based on your history and clinical experience alone. And having that volume of experience is so critical to developing really superb clinician.
Like in industry, people have said that it takes about 3 months to build high-functioning teams. We do it in 2 weeks and 4 weeks, and in part because we select people with common commitments. But the skill of a junior to congeal a team and create a learning and working environment in which other people thrive and enjoy coming to work, that's an invaluable skill that you take to whatever you do.
In many ways, my experience on the as a medical resident here was the apex of my career, and it's been all downhill from there. It was during that time that I really took my book knowledge as a medical student and converted it into an ability to care for people. And I just felt that the camaraderie among the house staff, the relations with the staff, the nursing staff, the entire institution was intoxicating and made for just an incredibly invigorating and stimulating experience.